Hey everyone, welcome back to another Explainer. Today, we are unpacking a really critical shift happening in modern healthcare, the rise of lifestyle medicine and the clinical blueprint we desperately need to actually save our medical system. We're going to explore how changing our daily habits isn't just, good advice anymore. It has literally become a rigorous medical discipline.
So, here is our roadmap for today. We'll be looking at the chronic disease crisis, the physician training gap, defining lifestyle medicine, core clinical competencies, integrating holistic practices, and finally, a systemic healthcare shift.
All right, Section 1, the chronic disease crisis.
We really have to start by acknowledging the massive, undeniable elephant in the global healthcare room. Our medical systems are buckling, and the root cause? Well, take a look at the scale of the problem. The World Health Organization estimates that 2/3 of all diseases worldwide are caused by our lifestyle choices. By 2030, we are looking at 52 million annual deaths, driven largely by things like tobacco use, unhealthful diets, and physical inactivity. That is absolutely staggering.
And this puts us at a fundamental fork in the road. While reactive medicine, surgeries, medications, the stuff we rely on for acute crises is absolutely fantastic, it's missing the boat on prevention. We're treating late-stage symptoms, but we are completely failing to prescribe the behavioral changes that could stop these diseases in the very first place.
Let's move to Section 2, the physician training gap.
Now, you might be thinking, okay, well, why don't doctors just tell us to live healthier lives? It turns out doctors are struggling just as much as their patients are. Get this, a 2025 study of tertiary care physicians in Saudi Arabia found that a shocking 75.2% of them are classified as poor sleepers.
And what's wild is how their own occupational hazards are actively sabotaging them. The odds ratios tell a really clear story. Later bedtimes literally triple their risk of poor sleep, while shift work and on-call duties just drastically compound the problem. The medical system demands continuous coverage, right? But that completely destroys the physician's own circadian rhythm. I mean, how can an exhausted, sleep-deprived doctor effectively counsel you on healthy sleep hygiene?
And that gap extends right into patient care. A survey of over 1,000 doctors in the UK focusing on smoking cessation showed a massive disconnect. 89% of these physicians consider helping patients quit smoking a top priority, but 50% of them feel completely unqualified and inappropriately trained to actually do it. They desperately want to help us, but they just don't have the tools.
One UK cardiologist in the survey really hit the nail on the head, saying, unless we make it mandatory, it will not happen. Without a structured framework built right into medical school, physicians simply won't get the behavioral intervention training they so clearly want.
Which brings us to Section 3, defining lifestyle medicine.
So, how do we fix this? Enter lifestyle medicine. And let's be clear, this is not just some wellness buzzword. It is a rigorous, evidence-based clinical discipline. It's specifically designed to give doctors those concrete tools they lack. Things like smart nutrition prescribing, stress management protocols, and exercise training, so they can actively support patient behavior changes and directly treat chronic diseases.
To standardize all of this, the European Lifestyle Medicine Organization, or ELMO, created a comprehensive curriculum guideline. This blueprint is designed to bring this discipline directly into medical schools, transforming lifestyle intervention from, a quick afterthought at the end of a checkup into a core medical competency.
Section 4, Core Clinical Competencies. Let's see how ELMO actually builds this. The ELMO blueprint is incredibly well structured. It breaks down into 5 main pillars: leadership, knowledge, assessment, management, and community support, which then contain 15 overarching clinical competencies. It demands that doctors don't just memorize the science, but actually assess a patient's readiness to change, collaborate on specific action plans, and, this is key, practice healthy lifestyle behaviors themselves so they can be authentic role models.
ELMO also organizes these competencies across 3 distinct domains of expertise. So interventions must target individuals through direct patient assessments, they must target groups by managing healthcare team workflows, and they even target the systemic organizational-wide levels. It's a top-to-bottom reimagining of healthcare delivery.
Remember those UK doctors struggling to help patients stop smoking? Here's what ELMO's training actually looks like in practice for that. Rather than just wagging a finger and saying smoking is bad, the curriculum trains doctors in structured approaches. That means using motivational interviewing to understand the root of why a patient smokes, and utilizing the 5 A's, ask, advise, assess, assist, and arrange, to systematically enact real, lasting behavioral change.
Section 5,
integrating holistic daily practices.
Because the truth is, clinical guidelines don't just exist in a vacuum. When we look closely at the behaviors lifestyle medicine promotes, they beautifully mirror ancient wisdom. Take traditional Chinese medicine, or TCM. It has been treating the whole person for over 2,000 years, evaluating wellness by looking at diet, sleep, and emotional health to find balance. It perfectly aligns with modern ELMO competencies.
TCM actually has this ancient concept of an internal body clock where different organs have optimal times for activity. For example, eating breakfast between 7 a.m. and 9 a.m. when the stomach is strongest, or doing deep focus work mid-morning. What's absolutely fascinating is that this maps directly onto what modern science now rigorously studies as the circadian rhythm. When we disrupt it, like we saw with those shift-working physicians, it causes massive imbalances.
Plus, TCM prescribes specific dietary habits, balancing warming and cooling foods alongside mindful movements like Tai Chi. Modern clinical science now proves that these exact mindful exercises activate our parasympathetic nervous system, our rest and digest mode, and actively lower cortisol, the stress hormone. This ancient practice is basically the literal application of ELMO's modern stress therapy and nutrition competencies.
Finally, Section 6, a systemic healthcare shift. Ultimately, bridging this ancient wellness with rigorous, modern medical blueprints forces a massive shift in how we think about healthcare providers. If we want to actually solve the global chronic disease crisis, it literally has to start from within the system. The very first competency in the ELMO blueprint requires physicians to be role models. We absolutely must empower the overworked, sleep-deprived doctors we talked about earlier to heal themselves first. So I'll leave you with this provocative thought. If our daily lifestyle choices are driving our greatest global health crises, how much longer can we afford to treat prevention as an elective? When will we finally demand that evidence-based lifestyle training, exactly as outlined by the ELMO blueprint, becomes the mandatory core of all medical education? Thanks so much for joining me for this explainer, and I will catch you in the next one.